Good evening. Welcome to Fresh Natural Live. It's Monday evening, and we have a great show lined up for you tonight. As a cardiologist, we deal with patients with heart disease. Many of them come in with acute flare-ups of existing heart disease. And, oftentimes we're, having to struggle between what's the underlying cause. Someone comes in with chest discomfort. The question comes up, are you having a heart attack? Are you having decompensated heart failure? And frequently we admit them to the hospital with lots of symptoms of shortness of breath, chest discomfort. What I wanted to do is share with you today is an underlying mechanism. We're going to talk a lot about inflammation of the heart. And that's an important concept because inflammation, as well as its near cousin, oxidative stress, are really frequent underlying contributors to acute illnesses of any kind. We're going to focus on heart disease today and how inflammation can be contributing to your heart dysfunction. Now, many people have underlying inflammation and they don't know about it. So we're going to talk about underlying mechanisms and we're going to talk about natural ways of either preventing inflammation of the heart or reversing it. So stay tuned. We have a great show for you tonight in just a minute. Okay, welcome back. And we're going to jump into a wonderful show we have for you tonight. I'm going to first welcome a friend and colleague of mine, Dr. Celeste Palmer. Dr. Palmer, how's it going?
It's good.
We're going to talk about inflammation in the heart. I know y'all deal with this in the pediatric world, especially since, people have been taking vacations. I won't go any further than that. People taking special vacations.
Yeah.
And young boys who take special vacations can get inflammation of the heart. And we call it pericarditis. But, inflammation can affect the whole body in different mechanisms. And we're going to focus on inflammation in the heart. So I'm going to jump into it. Have you seen any young boys with inflammation of the heart in your practice recently? Do you get that much?
I've seen one.
Mm-hmm.
And it was kind of when I followed through the charts to kind of see what the ultimate diagnosis was, it was diagnosis of post-viral.
Okay.
Yeah.
Post-viral. And viral infection, any infection can trigger inflammation of the heart. So that's certainly, and we frequently see it with, viral infections. Many people know about strep throat. That's a described mechanism where somebody as a youth gets strep throat. And over time, you can get inflammation of the heart. You get inflammation of the pericardium. You have inflammation of the valves. So you can have pericarditis. You can have valve disease. Many individuals may have to have valve replacement in their 40s or 50s due to strep throat. And so there's a long sequelae of inflammation. We'll talk about some of those mechanisms. Today, I'm going to focus on inflammation of the heart and one of its close cousins, oxidative stress. And I'm going to examine a patient that we treated in our practice who had an acute decompensation. And we're going to talk about how we managed her case using nutrition. And we'll look at some of our research. And I want to just kind of discuss this whole concept of inflammation of the heart and some of the mechanisms. I'm giving a slight warning. It's going to be a little technical. So there'll be some technical terminology used up front, but I'm going to break it down for you. And there'll be a little bit of details on the clinical case. I'll break it down for you. But the key, I try not to hide too much of the technical stuff, while at the same time, I try not to, overwhelm you with it. But I want you to get your arms around it and understand this clinical process. So the more you understand, the better you can deal with it. So let's just jump into my little slide presentation here. Let me see if this presentation goes well. So inflammation and heart failure. Inflammation can cause heart attacks, heart failure, pericarditis, a lot of different cardiac disease. You can have severe hypertension, which you have hypertensive heart disease. That could be due to acute inflammation, not of the heart only by itself, but the whole cardiovascular system. So I'm going to talk about it from the perspective of chronic disease. Chronic disease is oftentimes what we sort of walk around with, and then we can have flare-ups of chronic disease. So that's like if you have an existing heart condition, maybe you have a history of coronary disease or a history of heart failure or hypertension, and then for some reason out of the blue, you get acutely ill. Maybe you have acute chest pain, shortness of breath, you start to swell up. That's a flare-up. And so you have chronic, then an acute flare-up of the chronic condition. So we'll talk about, some of those mechanisms, the underlying causes. So first and foremost, I want to get some definitions out of the way. Chronic disease in general is any adverse, condition that's expected to last for more than a year. Pretty simple. If you have high blood pressure, you had it for more than a year, or heart disease or whatever, it's expected to last a year. And these are just common disease that we know about: heart disease, cancer, diabetes, chronic lung disease, arthritis, chronic infection. I can go on and on and on with the list. The thing is that I don't like to think of diseases from the standpoint of the label, not from the standpoint of using the label only. What I like to do is I like to, describe it from a label standpoint. Say, well, you have a condition that we commonly know of as chronic, obstructive lung disease or heart failure or hypertensive heart disease. But that's just kind of an overview. What's more important for me from the standpoint of helping the patient manage it or treating it is to think about the underlying process. And so we're going to talk about two underlying processes. There's probably a third that's important for chronic illnesses. We won't talk about too much, but I'll just mention it. The first of which is inflammation, which is a critical underlying cause. And inflammation can be thought of as a biochemical fire. So you have this biochemical fire that's underlying, and this biochemical fire could be a process that's underlying and contributing to your heart condition on a regular basis without you knowing. So it may contribute to high blood pressure. It can maybe contribute to weakening of the heart. It may be contributing to the stiffness of the heart, arrhythmias, and you may not have symptoms early on. But it can contribute to other diseases, cancer, neurological diseases, pulmonary diseases, and the like. So chronic inflammation contributes to chronic illnesses in general. It's an underlying process that builds over time, and you can go about your life feeling well or thinking you're feeling well, and the next thing you know, you have a diagnosis because this inflammation fills in. Real quick, I'm going to take a brief pause. Those of you, if you get a chance, hit the thumbs up button, thumbs up, thumbs up, thumbs up. Hit the like button if you enjoy what you're seeing. Let everybody do that right now. That helps the algorithm send this important information out to other people. Also, if you haven't had a chance to subscribe, please do so. You'll get more information from this channel, and share this information with any friends, loved ones, or anyone you think would benefit from this information. So the other component I want to mention briefly, even though we're talking primarily about inflammation, is this condition known as oxidative stress. If any of you have bitten into an apple and see it turn brown and kind of decay before your eyes, that's oxidative stress that you can see. Normal cell can undergo the same type of process where here's a healthy looking cell and then it starts to break down. Free radicals, molecules that we refer to as free radicals, can attack the cell. It can attack cells, it can attack the cell membrane, the DNA, and have lots of adverse effects. And this progressively leads to the cell, the tissue, and then the organ weakening and dysfunctioning over time. And so you have this molecule, we call it a free radical, that's just a medical term, and it's an unstable molecule. So if you think about unstable molecules, radioactive molecules are like unstable molecules. So it behaves like a pseudo radioactive molecule. And these molecules, if they go unchecked, they just bounce around your body, causing damage to cells, causing damage to tissue, and weakening your organs over time. Again, these things happen without your feeling symptoms. So it may be causing damage such that you're developing cancer. It has an adverse effect on the immune system. It may be causing damage to weakening your heart, or stiffening your blood vessels, stiffening your heart. And we'll talk about some of the mechanisms in just a minute. The way you can stabilize these free radicals is use of antioxidants. And antioxidants are things like leafy green vegetables and the like. So when you do a detox and you're nourishing your body with leafy green vegetables, you're consuming these antioxidants, and they're going in and stabilizing a lot of these free radical molecules that's floating around, and it stabilizes them, so it prevents them from causing damage. And then a third component, which I won't have a slide on, just to mention briefly, is the microbiome. And I'll probably do a talk about the microbiome itself, but just suffice it to say that your underlying microbiome is your body's ecosystem. It's microbes, be it bacteria, viruses, fungi that live in and around you. And they play important roles in metabolism, enhancing immune system. They can help decrease inflammation and the like. So the microbiome, which can become abnormal in a poor lifestyle, can be normalized with optimal nutrition and optimal lifestyle. So acute and chronic illness. So let's think about the acute flare-up of inflammation. So here we're going to throw a few technical things at you. Bear with me. I'm going to break all of this down. Inflammation in the setting of acute cardiac injury. So this is where you can have acute inflammation that affects the heart muscle and heart tissue itself, and the heart can become weak and stiff. What are some of the underlying mechanisms? So the pathogenesis, or abnormal pathological process that can lead to heart failure, have different mechanisms. First, they can include pro-inflammatory cytokines. Cytokines are just a fancy term for molecules that are released to signal other inflammatory cells to come in, and these inflammatory cells can do a lot of damage at the tissue site. So if you have some initial inflammatory cells that are caused to the heart muscle because of abnormal chemical signals coming from the heart muscle cells, then these inflammatory cells will then go there. They'll sound alarm and signal other inflammatory cells using these cytokine molecules that come from different parts of the immune system, the spleen, adipose tissue, and the like, and it causes further amplification of the inflammation. There's some cytokine molecules, IL-1 beta, TNF alpha. The names are not so important, other than the fact that we are able to measure certain cytokine molecules, and we can detect in your blood if you're having increased inflammation related to these cytokines. And when I show you some of the data we're looking at, some of these names may be important. The important part is that it can weaken the heart, causing systolic dysfunction, and stiffen the heart, causing diastolic dysfunction. So, so acute heart failure can be a cytokine storm of the cardiovascular system. Many of you may be familiar with the phrase cytokine storm, because that was used a lot when we were talking about coronavirus infection. Many of these people go in, they get the infection, and they have this systemic inflammatory response. Their lungs would white out. They have to be intubated. They get sick. They have blood clots forming and clots forming everywhere. That's a cytokine storm. What is that? That's diffuse inflammation and oxidative stress building up all throughout the body, causing increased clotting, causing inflammation in the lungs. In that case, where the lungs white out, many of these people had heart attacks and strokes. Again, inflammation, a cytokine storm in the cardiovascular system. Many of these people had heart failure that developed, even in the setting of COVID infection, and sometimes setting in other treatments for the COVID infection. So cytokine storms is not specific to COVID. It's actually related to lots of different acute and chronic illnesses that we deal with. Now, if you look at inflammation in the blood vessels, we look at the endothelial cells. Endothelium is the inner lining of the blood vessels. And so you basically have inflammation in these endothelial cells, as microvascular endothelial cells, and it can have a lot of effects. Endothelial cells are important for the production of a molecule called nitric oxide. And so nitric oxide generation is decreased. We want more nitric oxide, not less. And so inflammation affecting the endothelial cells can decrease nitric oxide. And so this has some important effects. One, it can have an effect on this giant cytoskeletal protein called titin. tighten. This protein can lose phosphorus bonds, become hypophosphorylated. That's just a fancy term related to the chemical abnormality of this protein, and it leads to stiffness in the cardiomyocyte. So this cytoskeleton model, think of the frame around your house. So this is the frame around the heart. And this frame around the heart needs to be pliable. It has to have some flexibility. But if you have decreased nitric oxide, this frame around the heart is no longer pliable or flexible. It becomes less flexible. And so the frame around the heart becomes stiff. And so the heart itself becomes stiff. The other thing that happens with decreased nitric oxide production is there's a molecule or enzyme called protein kinase G. Again, the name's not important, but the important thing to know is that it causes thickening of the heart muscle cells. We call it hypertrophy, and it makes the stiffness or diastolic dysfunction more worse. The problem with a stiff heart, if the heart is stiff, the heart needs to be flexible like a balloon, just like you have inflate a balloon with air. The body needs to inflate the heart left ventricle chamber with blood. If the heart is stiff and it can't dilate, when blood tries to fill that chamber, it doesn't fill up. And so less blood goes in, less blood to come out. So a stiff heart can lead to heart failure. And that's one of the mechanisms that you have with inflammation. Endothelial inflammation causes a range of other effects, VCAM, E-selectin. These, again, fancy names, but what they mean is that these are molecules that trigger further inflammation that can cause this fibrosis and scarring. It can cause this abnormal microvascular dilatation, meaning that your very tiny microscopic blood vessels don't open up. These tiny blood vessels that are important for delivering oxygen to the muscle cells that allow them to function normally. Remember, all cells need oxygen and blood flow to function. And so if you cut off the blood flow to the oxygen and blood flow to the cell itself, then the cells start to suffocate and they start to create abnormal proteins and other abnormal molecules. They create more acid. And so you develop more problems that can have systemic effects. So fibroblasts and myofibroblasts, these are cells that causes more inflammation. So if you see you have this nitric oxide reduction and you would cause, stiffening through cytoskeletal stiffening, you cause thickening of the heart muscle, more stiffening, then you cut off the blood flow and you cause more scarring. That stiffens, weakens the heart, and it takes away from the ability of the heart to circulate and takes away from the ability of the heart to work. So what happens is that you get progressively shorter breath. So what you feel as a patient, when these little biochemical things are happening, your heart's a little bit stiff, circulation goes down, it takes a little bit longer to walk to the bathroom. You get a little bit more shorter breath when you walk to the bathroom. You have more chest discomfort or shortness of breath when you try to lift things that you normally are able to lift, but you can't. The innate immune system, again, we talk a lot about the immune system for coronavirus infection, but the immune system is also associated with acute flare-ups of heart disease. And I'm not going to cover a lot of these details too much, but TLR4, it's a signaling molecule that appears on the cells of heart cells, but these signaling molecules occur in any cell. There are two different types of signaling molecules that are important. One's called a DAMP, the other's called a PAMP. A DAMP cell, the cell has intrinsic weakening. So the cell says, I'm dying and suffocating. It shows a little signal, a flag. It waves on the surface saying, I'm sick. The immune system recognizes that and goes and destroys that cell. Another cell may be captured by a viral infection or a bacterial infection. It says, it waves another flag. We call that a PAMP. It's a signaling molecule. It tells the immune system, hey, I'm being taken over by a virus or bacteria. And so that signals more inflammatory reaction and goes and attacks those cells. Sometimes you get false signaling, so false DAMPs and false PAMPs, so it can cause a false acceleration of the inflammatory process. Stressors such as ischemia. Ischemia, again, is a lack of blood flow, a lack of oxygen. So that means the tissue is not getting oxygen. It can cause a release of these DAMPs. These are the signals for intrinsic cellular failure, because when the cell's not getting oxygen, guess what happens? It starts to deplete. The mitochondria doesn't work well, and all the other organelles don't work well. The cell gets sick and it starts to die, and it waves its flag saying, hey, I'm getting sick, I'm going to die. So low blood flow, ischemia, low oxygen supply, ischemia to the tissue causes the cells to start to suffocate. When they suffocate, they say, hey, I'm suffocating. It's through this molecule called a DAMP. And that damp causes more inflammation and can actually worsen the problem that you're trying to deal with. So the last technical component to deal with is this thing called oxidative stress. Remember, I said oxidative stress is a buildup of toxic chemicals in the body. We call them free radicals. The name is not important, but just remember that oxidative stress equals increased toxic chemicals in the body. We've got to neutralize these toxic chemicals. We do it with raw fruits and vegetables and other things that antioxidize the body. So if we don't neutralize them, we have increased oxidative stress. There are 4 things I want to mention with the increased oxidative stress. One is the electrical part of the heart. This is a lot of words here, but it causes a calcium influx into the cells. And the reason I gave you these details is some of you may be medically inclined, so I want to give you enough detail to chew on. And those who are not medically inclined, I'm going to summarize it for you. So that's why I gave a lot of these details. The increased oxidative stress results in increased calcium inside the heart muscle cells. Increased calcium causes heart arrhythmias. In the upper chambers, it can cause arrhythmias such as atrial fibrillation. You're familiar with that. In the lower chamber, it causes ventricular arrhythmias like ventricular tachycardia. So oftentimes when patients are ill, they have inflammation, increased oxidative stress, they may go into arrhythmias. Well, what do we do in medicine? Well, we treat them with antiarrhythmic drugs. Well, antiarrhythmic drugs can be helpful, but we're not treating the underlying process, which is oxidative stress and inflammation at the cellular level. So in theory, there should be a way you can treat this using therapies, i.e. raw food, that reduces oxidation, reduces inflammation, and therefore reverses these arrhythmias and other things. And we'll talk about that when we discuss our case presentation. Number 2, increase oxidative stress, again, by increasing more calcium influx through another kind of molecule. I'm not going to discuss the detail. It's a ranitidine receptor 2 molecule. Name's not important, but when we increase calcium in, it inhibits sarcoplasmic reticulum function through another receptor. In summary, it leads to a weakening and stiffening of the heart muscle. We call that contractile dysfunction. But the important thing, the electrical problems can go abnormal. The heart can be further weakened and stiffened when you have that. The next thing, mitochondria react to ischemic injury by producing increased level of reactive oxygen species. Reactive oxygen species are another fancy term for more chemicals. And so, again, that furthers the first 2 processes when you're not getting enough blood flow to the mitochondria. Mitochondria, the organelles inside any cell that produces a molecule called ATP. ATP is the energy currency. So just think of the mitochondria, among other things, being your ATM machines. So if you need more energy, just like you need money to go to the store, you go to the ATM machine and get cash. The cell needs ATP or energy to do its job. It goes to its mitochondria, the ATP machine, ATM machines for energy. But if that ATM machine is dysfunctional or out of order, then the cell doesn't get its energy and the cell can't do its work. So number 4, the increase in these reactive oxygen species causes scarring, called fibrosis. So there are 4 basic things. Again, in summary, number 1, electrical problems, atrial fibrillation, ventricular arrhythmias. Number 2, heart weakening, heart muscle problems, weakening or stiffening of the heart muscle and contraction. Number 3, inflammation due to mitochondrial dysfunction and poor energy metabolism. And number 4, fibrosis. Those are the things that you get when you have increased oxidative stress. Now, why did I go through all the details? I want to give you a feel for what's happening at the cellular level. I apologize if this is too technical for everyone. I hope you're able to get screenshots of that and go back to this video, get screenshots and look at some of these mechanisms. But the point is, get a feel for what's happening at the underlying level, because when we discuss this patient, I'm going to talk through some of the things that was going on with the patient clinically, and I'm going to try to map you to what I talked about biochemically. So overview and initial hospital presentation. This is a patient who came to us, she's a 66-year-old lady with congestive heart failure. She had long-standing heart failure. She had a leaking mitral valve. We call that mitral regurgitation. And this IVCD means she had an abnormal electrical conduction in the heart that predisposed to the heart contracting asynchronously. The right and left ventricle don't contract timely, and we call it interventricular conduction delay. The point is that she had an abnormal electrical problem with the heart and a very severe leaking valve. So her condition started worsening. Now, this patient was eating a plant-based diet, was kind of eating some plant-based junk food, and her condition worsened, which appeared to make her mitral regurgitation worse. And we saw her in the office, she was, more short of breath, and she was having some arrhythmias. This patient also had a history of lupus, and so the concern is that was she having a lupus flare that was triggering all of these problems as well. Lupus is an autoimmune disease, and it triggers systemic inflammation. So you have inflammation from another source that can then cause inflammation in the cardiovascular system. So this is a concern we have. Let's take a look at an echocardiogram. I'm going to give you orientation. This is the left atrium, the left upper chamber. This is the left ventricle. This is the aortic outflow tract, but it's kind of a skewed picture there. And so the left ventricle is kind of all of this, but you got papillary muscles and things here, so it makes it look like the two chambers. The right ventricle is here. I want you to focus on this area here. When I play the video, you're going to see lots of blood going back here, and I'll try to pause it in a timely fashion here. So you go here. Okay, I'm going to bring it back. Okay, now this is the mitral valve. This is all the left ventricle that you saw the papillary muscle and the apparatus from this valve come across here. But you have the left ventricle here. This is the aortic root. So blood is supposed to come from here to here. And then when the left ventricle contracts, this valve is supposed to close. And instead of the blood going here, it's supposed to all go here. Now you see some blood going here, and I can tell by the blue, some of the red going through, but you got a lot of blood going here. Too much is going here. That's going backwards. See, this is forwards and this is backwards. So blood should go from number one, from here to there. But when this contracts, instead of all of it going here, you got a lot going there. I'm going to come back here and play it again. So it's supposed to go from here to here, out here, but you're going to see a lot going there. You're going to see a large mosaic blue-green there. There, you see that? A lot going there. That's the wrong direction. That's mitral regurgitation. Now, I'll let it play through. Here, left atrium, left ventricle, the right ventricle. This is actually dilated. This is really large. This is almost as big as that. This is a little bit fluid around the heart, the posterior part of the left ventricle there. That shouldn't be there. So that's inflammation of the heart.
I have a question, Lex. So what, you might be getting to this, but what is her ejection fraction if she is?
Yeah, so the ejection fraction looking here, it's probably about 20%, 20-25%. You're looking at other, so it's pretty low. And in the setting, and a large percentage of that is going backwards. So it's even worse. You got a low ejection fraction with a good part going backwards. So the cardiac output is going to be very poor. But good question. And so we see the heart very weak. Now this shows the tricuspid regurg there, which is a certain amount. And here's the heart on the short axis. It's a little bit thickened down here. And you see it normally should be squeezing in almost completely. But it squeezes in just kind of in a minute fashion there. And that's the aortic valve there. And so here's another view of it. I'm going to go through this quickly. It's a little close up. And this valve is kind of tattered there. And there's a lot of inflammation in this valve. It's hard to see very well, but it doesn't completely close very tightly. In this view, it looks like it's closed, but if you look at a three-dimensional aspect of this valve, you see that it's not closing all the way. And you see in this, if you look at this part here, the ejection fraction, look, this should be thickening. See how? So this wall here and this wall, they should come together, closer together in the center. Okay, so that should squeeze down to here. This should squeeze up to there. And let's just see, it's barely thickening. See how this is barely thick? This should be thickening like this. This piece should come in like here. And this should come up like here. It's barely moving. You see that? And so that's congestive heart failure with a severe leaking mitral valve. This is the mitral valve, the aortic valve, and most of the blood goes back here and not so much there. So anyway, so this patient presented and she was short of breath. So we admitted to the hospital and started on intravenous diuretics. She had episodes of worsening cardiac arrhythmias. Now, when she got to the hospital, she would have these episodes of heart. She'd go into AFib or atrial tachycardia. Remember, I talked to you earlier. Underlying cause of some of these arrhythmias, oxidative stress, inflammation. At the cellular level, increased calcium inside the cells, increased arrhythmia. So the electrical part, number one, that we talked about on oxidative stress, could have been contributing here. So we see the arrhythmias. Yeah, we give her medications, but we must also think about the underlying process. So we had to put her in the CCU for a closer observation. We gave her medications. We've got her arrhythmia stabilized, got some of her cardiac function improved. So after, it took about 2 or 3 days, maybe 4 days to get that done. I called the structural heart team. The reason for admitting her was to consider her for a procedure called mitral valve clipping. They can go in with a catheter and clip the mitral valve to keep it from, to allow it to close more efficiently and keep the leaking from progressing. The structural heart team, which is a good cardiologist, colleagues of mine, excellent guys, they felt that she was too sick for the procedure. It wasn't an open heart, but it was, so they looked at her and they read the chart and they saw us struggling with the arrhythmias, saw that she has a history of lupus and looked at the ejection fraction. But look, with her comorbidities, we felt she was too sick. I talked to my EP colleague and felt that, well, could she benefit from a biventricular pacing? I mentioned she had that electrical abnormality. If we were to fix that with pacing, synchronized pacing, that could also help the cardiac function. She looked at it and felt that she was too sick also. And she probably saw the note from the structural heart doctors. So she was too sick to undergo those procedures. And that was the main thing we were going to look at to improve her condition. So, they recommend calling the palliative team and our team called the palliative medicine team. And they said, well, let's get her in inpatient hospice. And so we optimized the medication, got her stable. We had her on, she was taking an over-the-counter vitamin C that she had. We left on that. She was on the diuretic. She was taking hydroxychloroquine for her lupus. We put on an infusion medicine called milrinone. It helps strengthen the heart a little bit, helps it squeeze a little bit better. She was on pantoprazole, which they typically start. And the sotalol was the medication we had given her to control her arrhythmias. Now, remember, oxidative stress, inflammation, triggering the arrhythmia mechanistically, but we were treating it pharmacologically with this antiarrhythmic drug. So the patient, agreed to go to hospice, and we're just going to go there and kind of wean her off and let her pass on. Nobody had much to offer. So when we discharged her to hospice, she came back in about 24, 36 hours because there was some confusion. The hospice unit was not able to manage the IV milrinone. And so they called around to other hospice facilities and none of them gave milrinone. So the palliative team was called back and they said, well, it's nothing we can do. We just have to stop the milrinone here in the hospital and let you die here. So I went in the patient room and, she was in tears and says, I'm about to order my last meal and, everything's bad. And I said, look, none of that. I've got an idea. More tricks up our sleeve. So we said, let's just detox the patient. Again, thinking about those underlying mechanisms. Why is she so sick? Well, she's in acute inflammation, oxidative stress. So she's got, end-stage heart failure. There's nothing to do. Too sick for surgery, too sick for medications, too sick for everything else. But she wasn't too sick for detox. I talked to the hospital case manager. Look, give me 7 days. And we will detox her and wean her off the milrinone. Now I had to convince the patient this is going to work. So I said, look, enough of this pity party. We need to detox. And I said, here's what we're going to do. We're going to do this, and this is how it's going to work. Now that's an important factor because the patient has to be on board mentally, psychologically, and everything else. So she was with it. Okay, let's do it. So we brought her, raw smoothies, and green salad. I saw it on the smoothie feast with lots of blue green algae, super greens, all of that. So she was just on smoothies. The important part just on smoothies, raw smoothies up front, is that, someone this sick, digestion is going to be a problem. So we don't want to give her solid foods. So smoothies or cold pressed juices can be very, very helpful. What it does, it nourishes the body, allow you to rest uh, 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 biochemically. And as she was doing that, it was helping to put out the inflammation and oxidative stress, and we remove every bit of the other food.
Dr. Montgomery, can you specify what types of smoothies? I know you said green, but when you say green, are you talking about fruity green? Or are you talking about
Yeah.
just straight
So good,
vegetable?
yeah, good question. It was mostly vegetable greens. Now we would add like one fruit. Sometimes we do soaked organic dates to cut the bitterness, just to give the patient a sense of pleasure. But the smoothie she had contained beets, kale, spinach. We had blue green algae, which is a superfood, and we also had our super green mix, which is a mixture of organic greens. I think it has wheatgrass and it also has an algae in it, but it's freeze dried, it's organic, broccoli, spinach, it had other sprouts in it, lots of superfoods in it in a powderized form that we mixed in with the smoothie and added it. There was some fruit. It's usually like in ours, we usually do like a date. Sometimes it'll be a mango, something a little sweet to cut the bitterness of some of that. So that's what we did with her. The other important thing we did was wean her medication. I cannot overemphasize the importance of weaning medications. If any of you have loved ones, you're trying to help them nutritionally, get with the doctors and ask the doctors to help minimize the medication as much as possible, because that's important. And that's the thing we did with her. So, in summary, I'm just going to kind of go through some of the clinical details. Excuse the business of the slide, but serum creatinine is a molecule that we measure to look at the kidney's filtering ability. So the higher this number, the worse the filtration. The lower the number, the better the filtration. When she came in, her filtration rate was low, so this number was relatively high. It improved with some of the medications. When she went into the arrhythmias, it got a little bit worse because her circulation of the heart was worse, and so the kidney function was worse. We got all that arrhythmia under control and the melanone, and this is when she was discharged, but they couldn't give the melanone. She was off the melanone. The kidney function got worse because the heart function got worse in just that 24 hours. So it got worse. So we started detox. This orange bar represents the time of detox. And we detoxed it, she came down. Now remember, we were detoxing and weaning medication. So she was coming off the melanone and off the other medication. But despite coming off the medication, she remained stable. So the kidney function remained stable. The GFR is kind of the opposite of the creatinine. So the higher number, the better the kidney function. The lower number, the worse the kidney function. So she came in, the kidney function was okay, got worse with some of the arrhythmias, got better with stabilization. Got worse with the arrhythmias here, better with stabilization of medications. Went out, but when she got off the melanone, it got worse here. And so here you have, we start to detox and the kidney function improved. The GFR's perfusion off medications on nutritional detox. Lactic acid. When lactic acid is high, that means your circulation is low. You're not perfusing, so the tissues create acid. We got it down when we stabilized her, but when she came back and went back up, she was off the melanone. Detox brought it back down. Again, liver congestion, it stayed down with detox. Same thing, liver congestion stayed down with detox. White blood count's a measure of inflammation. It went up and down. After you started detox, notice how it went up. And that's the sign you see with detox. Sometimes after you started detox, you have an acute inflammation. It's probably due to the fact your body's releasing toxins from the cells into the blood, but it came down as well. But the big thing is that we weaned her medication. Now, I stopped this vitamin C because of over-the-counter vitamin C. She was on regularly scheduled furosemide, which is a diuretic, regularly scheduled hydroxychloroquine, which was supposed to decrease inflammation from the lupus. The melanone was her lifeline. That's what we were going to stop and let her die. So we had on melanone, pantoprazole in this arrhythmia. We control all of these things. We control the arrhythmia. We control the cardiac function. We improve the heart function. And we decrease inflammation from the lupus. And we allowed the heart to perfuse the kidney so that she didn't need diuretics. We had on one diuretic on an only as needed basis. And I'll tell you, she really didn't need this. She took it maybe once or twice. But after she was out for the 3 months that she was out, for 2 or 3 months immediately after discharge, she probably only took maybe a few doses at most. So essentially almost no medications. And that was important because the medications are frequently metabolized by the kidney and the liver. So medication change, a major, major drop there. Again, reflecting on the mechanism, the food was treating the arrhythmia and the heart dysfunction at the cellular level. Remember, we talked about inflammation, oxidative stress causing what? Increased calcium in the cells, electrical problems, atrial fibrillation, atrial arrhythmias, causing what? A contractile dysfunction, weakening and stiffening of the heart. All those things mechanistically was happening at the cellular level, the tissue level. When we address those things with the food, again, at the cellular level, the tissue level, we were able to remove the medications and the heart started beating more effectively, relaxing more effectively, and controlling the arrhythmia by mechanistically treating the body, treating these mechanisms. Oxidative stress was reduced, inflammation was reduced, and the cells started to heal at the cellular level.
Can I ask a question real quick?
Yes, absolutely. Yeah, please interject.
In the applications standpoint, with the liquid detox part, how long was that? How long did it take her to get to a level where you said, okay, we can do solid food, raw food, in addition to the liquids? Because I just want to know how long, I know the dates were on some of that, but from the start to kind of we're seeing improvement, how long did that take with the liquid versus liquid plus raw foods?
Yeah, that's a great question. Every patient differs. In this patient, I remember on day 4, we started adding salads. She stayed on the smoothies. We started adding salads. And the barometer there was that she was on day, like 4 days. She had, I think, maybe 4 full days of just smoothies. And then she started saying, okay, I want some salads. So she started feeling hungry. She was feeling better. And those first few days, she was getting better. And then her appetite picked up. And so what happened, then we started adding salads. And then I think she even had some of our raw. I may have even had her try like a beet burger or something like that, which is actually a pretty heavy food. Now, she was still on the smoothies with the coconut water and that type of thing. But then we added some salads probably on day 5 or 6, and as she was going out of the hospital. And that was just for patient comfort and satisfaction and the like.
Okay.
But yeah, but just an added comment, what I try to do in a patient like her, I would try to do like 10 days of all smoothies or cold pressed juice, or maybe even 2 weeks. So I like to have them go even longer with time restricted eating, because the longer we go with the more aggressive detox, the more healing. And I'd even add a time restricted eating. So, we probably go, full day smoothies and juices at the beginning, and then do some time restricted eating, maintaining hydration, because then that gives more healing. And again, we're letting the body recover over time. So yeah, that's a great question. Now, just looking at some of the data we've done before. So why do we know to do this? Well, we've actually published in the medical literature patients undergoing a very, very similar, or to some extent, the same type of raw detox. And we look at the biochemical parameters. Everybody knows about hemodynamic and anthropometric effects, i.e., weight loss and blood pressure reduction. Now, these things aren't trivial because, yes, we measure these things. Weight loss is important for patients who need to lose weight. Blood pressure reduction is important. But this patient actually had a tenuous blood pressure, and she was already on the small side. So she didn't lose a lot of weight. And sometimes the blood pressure low, it comes up. So this was a population of people with hypertension and high BMI. And so they had weight loss and blood pressure reduction. But some people with weak hearts can have the blood pressure improve with cardiac output improving and cardiac function improving. And so, but they also had medication reduction. Why do I hound on medication reduction so much? Medication reduction is important because in these patients that are taking medications that have to be metabolized through the liver, et cetera, notice this patient has some liver congestion. If you're taking a medication that has to be broken down by the liver, and the liver is already under stress due to heart failure, then you're putting the liver under further stress by giving them medications. And sometimes the liver is under stress due to poor circulation. They may have fatty liver from taking medication for a long period of time. So the more you can wean the medications, the more you take a stress off the liver. Why is taking stress off the liver important? The liver is the main organ for doing manufacturing, and it also has a function cleaning the blood. So the less toxin you're putting in, the less toxin the liver has to neutralize, and the more it can work on endogenous toxins to help clean the blood up. The cleaner the blood, the better the heart function, better the kidney function. So these things have a synergistic effect. So medication reduction is extremely important in that regard. In our study, we looked at a case series of heart failure patients. We saw that the ejection fraction in a case series of patient went up on an average of 22% to 44%. The thickening and stiffening of the heart mass went down. Remember, I told you some oxidative stress can cause thickening of the heart muscle cells. We saw that reverse with nutrition alone in our case series. When we look at MRI, measuring the thickening of the heart, we saw stroke volume, the amount of blood that the heart squeezes. Remember, the amount of volume of blood the heart squeezes out is a factor of the amount of blood that comes in. How much blood comes in is the amount of the relaxation of the heart or the lack of stiffening. So the stiffer the heart, as we talked about, increased calcium influx, decreased nitric oxide, results in thickening and stiffening of the heart muscle. If you have that thickening and stiffening, the stroke volume is low because you don't fill up as much volume. So LV mass is a measure of thickening. Stroke volume is a measure of stiffening indirectly. And so we saw an increased stroke volume, likely due to decreased stiffening, and overall circulation, cardiac output trended toward improvement. Here's some other biomarkers. C-reactive protein is a measure of inflammation. In just 4 weeks, we see a 30% reduction in inflammation. So we know with a raw detox diet, we have an aggressive reduction in inflammation. IL-6 is an important cytokine that triggers other cytokines, a 23% reduction in IL-6. TNF-alpha, we didn't see a reduction in 4 weeks. It may take longer for this to go down. Plaque-2 is an indirect marker of vascular inflammation, goes down by 16%. White blood count goes down by 22%, and other inflammatory markers go down. So we know that inflammation goes down. The immune system is turned down, so it's no longer in disarray. Cholesterol, other biomarkers go down. Hemoglobin A1C is a metabolic biomarker, and we see that go down by 3.4% in just 4 weeks. Now you say, well, those you know what the hemoglobin A1C is, it marks the average blood glucose in 3 to 4 months. But what happens is that the other thing that influences hemoglobin A1C is what we call postprandial increases in blood sugar. So certain foods you eat, like foods with high protein, high fat, trans fats from dead animal flesh, it causes the blood sugar to go up after you eat. And so that causes a fluctuation in blood sugar. So this fluctuation in blood sugar with these wide swings can increase hemoglobin A1C. When you go on a raw detox, it decreases the fluctuation of blood sugars and decreases the hemoglobin A1C. C-reactive protein we already talked about. So as Dr. Palmer asked about the food, there's a quick word. Generally speaking, we allow them to eat some solid foods. This patient had mostly smoothies. She added some solid foods later on. She had something equivalent to this. These are nori rolls. You can think of this like a salad in a roll. This is a beet burger, a Hulk burger. These are dehydrated onion rings. These are sprouted wild rice. So you can have a lot of savory raw foods. And there are other patients are treated in the hospital, and they get the food from a nutrition center. We try to keep them off the hospital food. Better than tuna sandwich, which is delicious. The E3 AFA, this is a powder form of the E3 Live. We have them do a liquid form or powder form. We add it to coconut water. And this is a superfood that has lots of minerals and vitamins and nutrients. A premium green greens we have that helps with detoxifying the body. Again, this has freeze-dried organic grown vegetables. So the food is quite palatable, and it's something that can really help. I throw this slide up here just so that you guys can have some information about us. Take a screenshot if you want to learn more about some of our programs. We have an online community that helps talk about this stuff, the website, and we do online coaching. So if you have a condition and you're from outside the Houston area, we can still reach you, and this is based on information. So I'm going to leave it there. Thank you for your time and attention. Dr. Palmer, you had another question or comment?
Well, I was going to just ask you to answer some of the questions in the chat. Now you hit most of them.
Oh, good. Yeah. Thanks for keeping up. I've been kind of glancing, but I haven't.
Yeah, you touched on most of them. One question that somebody had that, is a fair question. Once the heart weakens due to oxidative stress, can the weakened heart regenerate itself once the patient detoxes and changes their diet long term, or once the heart is weakened, it's always weakened? So, I think we kind of already answered that, but then the next part of that I think patients don't recognize, the idea is that you stay in that lane. Like, the idea is not that you heal and get better and then go back to your previous life.
Yeah. No, that's a great point you raise. And the answer is yes, it can heal. It may not go totally back to normal, but as the case series I showed you showed that you get improvement, significant improvement. And notice that it's improving not only with the heart, but the whole cardiovascular system. Notice that not only the heart's improving, the liver's improving, the kidneys improving, and the GI tract's improving, the microbiome. So all these organ systems are working in synchrony, in symphony, and they're working together. And so they're enhancing. So the heart may not be back to normal, but it may have some deficiencies made up by another organ system, et cetera. And so the whole body will get back to a state where it's functioning normally when you're doing better. And even the brain, so the psyche, which is really important. So this patient went from hospice to say, okay, you're on no medicine, you're feeling fine, you walk around the hospital and going home, and you're doing great. So that's a huge psychological boost. So even that part is contributing greatly. But I think, Dr. Palmer, you touched on an extremely important point, which is staying in the lane. Now, I cannot overemphasize this because her disease, despite all the stuff I showed you, was not heart failure, was not mitral regurgitation, it's not lupus, it was not, blah, 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 liver dysfunction. Her disease was the desire for bad food. And we all develop a lifelong desire for the foods that are detrimental. And it's really the desire for those bad foods that's the treatment, because we could do all this stuff, you could detox and get better, but if you have that continued desire for the bad food and you give in to that desire, you fall back into that, and it can lead to your demise.
Somebody else asked, will raw program help with chronic liver scarring or hepatitis?
Yeah, we see that a lot, and the answer is yes. It's really interesting because people ask, how late is too late. I think the only time we've tried this in the group of patients got consistent failures when we went to the graveyard and we sprinkled detox food on the graves, and we've yet to have anybody rise. So that's something that we're still working on. But short of the grave, we've seen people on life support turn around. So regarding the question of liver disease and hepatitis and scarring, yes, you have scarring, but typically people with scarring has some viable liver tissue, and some of the tissue that looks like it's scarred may not be fully scarred. So again, you need to do aggressive detox and cleansing, and medication weaning. I cannot overemphasize that is extremely important in those patients.
Somebody asked, how much vitamin C?
Yeah, great question. So the vitamin C in patients with vascular disease, we will start them off with, say, about 3,000 international units, and we'll go to 9,000. It just depends. So like people with bad atherosclerotic disease will probably use more. People with cancer will probably use more. In some patients in the hospital, I'll use intravenous vitamin C a lot, 1,500 milligrams every 6 hours, or that's roughly 6,000 milligrams a day intravenously. It's been shown to reduce oxidative stress and reduce inflammation, etc. So, question.
One more looks like I'll recommend to be a pacemaker. Can you help?
Yeah, that's a great question. We've had different situations with pacemaker issues, and with heart failure, we were talking about doing biventricular pacing in this patient, and my colleague says, she's too sick. And so we got her well without it. So the answer to that question is yes. In certain cases, it can. Some people have advanced conduction system diseases, threatening to pass out. In those cases, you may want to do pacing initially to protect them, and then start to reverse things over time as it goes. Let's see. Did we catch everything? I didn't.
I think we cut. Somebody asked about, do you do online coaching, which you can do your commercial.
If you got that information, online coaching, you can go to. Let me just bring that slide back up, just to be there. So the online coaching, I'll leave that up for a minute so you can look at it. But online coaching is there.
She asked, do we have to be seen in person for the first visit in order to access the online coaching?
No, you don't. That's a great question. So for online, all of these things here, the community, of course, our website has lots of information. The online coaching is a non-clinical online position. So you can go on that today, online.montgomeryheart.com/lifestyle. And that's our healthy lifestyle series. That's the one that we recommend. That's a 1-year coaching. You start off with a detox session series where there's 5 sessions over 4 weeks. And we walk you through a detox program. And then you have lots of content. You have videos, like 30-day videos of me walking through detox and maintenance. You got recipes, got video demos and the whole like, and there's educational videos with that. But you have access to myself and my team where we can walk you through the specifics. So that's a great program to go through, online.montgomeryheart.com/lifestyle. Take a screenshot here. But yeah, that's a great, and none of these require a office visit. Of course, you want an office visit, you're welcome to call us on the number 713-599-1144 and wellness@montgomeryheart.com as well. And we're located in Houston at that address. But great question. And hello, everybody. I'm seeing some familiar names. Sorry, I was just focused on my slides. How can you help someone with a mitral valve leak and surgery is not required now? I think the same thing we did here. And remember the leaking valves. Think of leaking valves or stiff valves that are inflamed. So if you have a valve that's inflamed, it will not close normally or may not open normally or both. And so there's some acute components and chronic components, but aggressive nutritional cleansing can reduce the inflammation and help the valve heal and or prevent the valve from getting worse. So if someone has a leaky valve, doesn't require surgery now, they want to make aggressive change in their lifestyle. So then that valve certainly doesn't get worse and may even improve or leak less because the less leaking may be due to other components other than just valve disorder itself. So that's important. How to increase your ejection fraction. Again, the things that contributes to your abnormal ejection fraction are the ischemia and oxidative stress. That's why I went through all that biochemistry at the beginning. And so you affect those things directly with the food. That's what helps biochemically. And so that's going to be the critical factor. If you're going to be weaned off medication, with online coaching be helpful. We don't directly wean medication with online coaching because it's not a medical program, but we can direct you to talk to your physician and to wean medications. And if you need us to help you wean medications, and you take a little vacation trip to Houston, their airline flight, you can find a hobby and come and see us once. And once you see us once, then we can put you in our digital health. And so then you have the remote clinical follow-up in addition to the online wellness. But the state of Texas require that we see you up front in person before we manage you, from out of state remotely.
And I have something to add to that, because that's a really important point, because you said that weaning the medicines is paramount in, this healing process, especially in a critically ill patient like this. Mm-hmm. And weaning medicines is not something that a lot of our colleagues is accustomed to doing in this type of setting, especially. And you see how much science and how much intricacy is involved in something like this. So, I mean, I think when to give Dr. Montgomery his uh, do as far as knowing this information, there are not a whole lot of doctors that are going to do that. And I'm saying that because I've worked with people in my family who are older and on certain medications, and the doctors do not voluntarily wean. Or even kind of recognize that things are getting better because they already have set in their mind that it's going to go this way, 1, 2, 3. It can't go in another direction. So that is something where, coming down here, which I know some of your patients do, is a realistic option. And then to have, you all on board.
Yeah, and that's an important thing. And I'll add, my colleague, Dr. Palmer, does work with patients too. So you have any pediatric patients that need help, you come down and seek her out as well. And because that would be really key. And she recently coached a patient whose baby was born with a congenital hole in the heart. And she coached the patient's mother, and they did a number of natural things. And the cardiologist prescribed them with diuretics, but the patient mother never took the diuretics. Now, she didn't tell her not to take the diuretics, but she followed her and coached along with the natural things. And the latest I heard is that the patient, the baby, is better without the diuretics and the holistic thing. You want to add to that, Dr. Palmer, in terms of the upgrade? Did I say enough or too much?
No, you said enough.
So I'm putting her on the spot, but that's okay. She likes to hide her secret, her magic, but she does a lot of magical things. There are a lot of things that we do here in the Houston area that's really powerful. And so again, hit the thumbs up button, share, like, subscribe. This is something that we want the world to know about. We have a small fledgling channel. We're doing some things to grow it. I'm getting some help, but you can help us grow it now by sharing this. So share this with 20. Each of you go on and share this with everybody watching, whether you're in the chat or not. Share this with at least 20 people that you know, maybe even 100 people if you can, and have them look at this video. Anything else, Dr. Palmer, before we sign out?
No, I mean, I think, it's good information, and it's time that people know that there are options, and we have to take some accountability and start now.
Yeah, and the answer to Regina Coleman's question, or somebody's question, do we still have a 7-day program? We do have a 7-day program. Let's see, Ms. Brunson asked that. There are a lot of programs. You go online and send an email to our team, or call the office and ask about the 7-day program. And we have meal plans and the like if you're in the Houston area. If you're not in the Houston area, we do ship meal plans. And so there's a whole host of things. You can go on site and we can send an email, and we can give you a call as well.
And I do want to add one more thing. I think, it's good that we want to do these programs, but when I say we need to start now, I think we need to start changing our mind about detox, the word detox, and this needs to become a lifestyle. So we don't think about it as something that we just do for, 4 weeks or 7 weeks, and then we kind of go back. Yes, we do it for 7 weeks, and then we make changes after that 7 weeks until we do the next detox in the next, few months. We do another 7 weeks, and we make changes every time we do a detox, such that in 2 years or a year, or however fast you want to do it, now we've gotten to a point where we live in that space.
Mm-hmm.
I mean, we will always have to do some type of cleansing because of the environment that we live in. So, I mean, that's true, but we can now remove thinking about, did these potato chips is going to cause me high cholesterol? We can take that off the table. We got a whole lot of other things on the table to deal with.
No, that's exactly right. I think the mindset is really important. I think the long-term change is not a fad. You're exactly right. And we kind of come into it for 4 weeks and then trick you and say, oh, by the way, let's keep going. But no, I think getting your arm wrapped around a certain finite period of time is helpful, but you're exactly right. It's really a lifetime, especially if you have advanced diseases, and it really does work. It just takes the work to do it, and it's not as hard as you think. It's not nearly as hard as you think. I want to leave everybody with that comment. So anyway, all right, guys, thanks a bunch. It's been great, Dr. Palmer. I'm gonna see you backstage. As usual, we had a good time tonight. I hope you got some good information. Again, hit the like button, thumbs up, thumbs up, thumbs up. Please give us the like button so this will trick the YouTube algorithm in sharing this with other people. Also, you go on and share it with other people as well, because I think this is good information for us all to have. I enjoyed this session with you this evening. I look forward to seeing you next week. And until then, keep it fresh, natural, and live.